So today we are going to talk about one important topic which is very common and we can see in everyone's life or in every family. We have one patient definitely, or we can say that at the earlier later stage of life, most of the people suffer from this disease. That is nothing but hypertension. Okay, hypertension in shortcut we will write HTN. So basically, hypertension. What this means hypertension? So we have heart. Already know that heart have pressure means to send the blood to all body parts, all body areas. It need pressure to pump forcefully. Okay, so that force is given by SA node and AV node. Electrical impulse will convert into mechanical impulse and the force is applied to the heart and it will send the blood to the all body parts. So this is the thing, one thing. So basically the pressure which is applied by the heart will admit that is blood pressure. What is that? It will nothing but by blood pressure. In that we have two figures, that is systolic and diastolic. Systolic means the pressure applied for contraction of heart, the pressure required for relaxation of the heart. So basically systolic is 120, diastolic is 80. So this is the pressure we need. So if it is increased in daily life, okay, more than 120 systolic and more than 120 by 80, we will tell that this person have hypertension means that pressure is above from the normal value. The person have hypertension means sometimes it is physiological, sometimes it is pathological. Physiological means certain conditions, during certain conditions the pressure increases. The pressure increases during certain conditions. After that, the value become normal. Okay. After doing that condition, after recovering from the condition, it will become normal. So this is physiological. Everyone will have in any while walking, uh, while you're becoming anger, stress during stress. Anything pathological means it will along with the person. There is a internal issue which leads to the increased BP. Okay. So we will have two types of hypertension. One is acute hypertension and second one is chronic hypertension. So today we will discuss acute hypertension only. Okay. If the BP increased suddenly the BP increased. So what we will call acute hypertension. There is a no past history. Suddenly the person came and he have the if check the BP, check the BP with the sphygmomanometer, the person having more than 120. Okay. So I already told you that they are the reason, physiological reasons. What are the physiological reasons? First we will discuss. Then pathological reasons. Physiological reasons. Okay. We'll discuss the physiological reasons where BP becomes low and high. First is age factor. Okay. So we have to see that in the from 1 year to 6 months. Okay. The range of the BP is 1 month to 6 months. The range of the systolic and diastolic. Okay. It is 70 to 90. In the diastolic, 40 to 50. Okay. In 1 year child, okay, 95 systolic, diastolic becomes 55. So this is normal. Okay. And gradually the BP increases. Okay. At puberty from the age of 14, 15 to 50 years, 120 by 80. Okay. After 50 years, okay, the BP will increase 140 by 85. After 70 years, 160 by 90. After 80 years, it will become 180 by 95. So this is the age variation, and that the BP increases. Okay. So this is normal condition. We doesn't need any type of treatment. Sometimes require treatment if any symptoms occurs. Okay. Next is female or male. This is the second physiological condition. Okay. In that you have to remember that during menopause, or sorry, during uh, periods, there is a slightly 5 mm of HGBP will slightly decreased. In the female means 110 to 115. Okay. And 80 to 70 to 80. This is the between minus or plus 5 decreased BP in the females during menstruation. After menopause means if you have the menstruation stop, then the BP becomes normal. Okay. Next, body build. Third is in the body build, heavy obese person having more BP, okay, than lean person. This is the if the physiological, we see if the physiological. Okay. And day variation. During day, the BP is on in normal range or slightly increased. During night, there is a slightly decrease. You can see in the BP levels during evenings. Okay. And another physiological condition, that is meals. After meals also the BP increase. Okay. For few hours, and during sleep also the BP decrease. Okay. We have to remember that minimum 15 to 20 mm of Hg, the BP will decrease. Okay. These are the things we have to remember. During exercise also the BP increases. Okay. Okay, slightly increase. Okay, in the third last one is in emotional conditions. During emotional conditions, the slightly the BP increases. So all this are the physiological. Emotional is not permanent. Night is not permanent. Sleep is not permanent. Exercise is not permanent. Means you are changing your activity. So this means the slightly the BP increases, slightly it decreases. So this is the physiological condition where you can easily see that person having will become the normal. Okay. So these are the things we have to remember. Next, uh, pathological conditions. Because one condition is not enough to the person is suffering from BP. Okay. It will become in high chronic also or in uh, other things also. Okay. First is you can see that. So we are talking about acute condition, like most of the things that during the pregnancy, during eclampsia. Okay, this is a one pathological condition. Next is goiter. Okay, this is also a pathological condition in the thyroid region or pituitary tumor. Okay, this is also one of the cause. And nephritis. All these are the pathological conditions. Means in that any other disease is there region, secondary reason. Okay, where the sudden increase in the BP will happen. Okay, so in that thing we have to remember all those things. And other than that, I am telling that the hypertension, any type of hypertension is divided in two things. One is primary hypertension, okay, and secondary hypertension. So we will discuss in detail about that primary and secondary. So first, primary hypertension. Primary hypertension means is there any there is no disease in the body, no disease in the body. Okay, there is no disease, there is unknown reason. There is a resistance increase in the body. That is the reason the patient having primary hypertension. So in that, if you go to the primary, then again we have two types. Primary here benign, and second one is malignant. Let's discuss about benign and malignant hypertension. Benign means this is normal. Okay, already I told you that the physiological conditions. Okay, so it will become normal. Okay, but if the benign will happen consistently, constantly. Okay, what will happen? It will damage the vessels. Like physiological, in the physiology we have discussed that emotional. So if you are always emotional long from longer periods, what will happen? Due to the increase in the BP, the vessels will damage. and there is also effect on the heart, and second, renal issues you can see. Okay, these are the things we have to remember. Prolonged physiological hypertension, which leads to vessel damage, heart damage, and renal diseases. So this is the thing we have to remember. In the primary, there is no cause, but over or of period, the patient will have some serious issues. Next, we have malignant. ठीक है? Malignant is also known as accelerated hypertension. What is also known as accelerated hypertension? In this, the BP will suddenly shoot out uh, 250, 200, between 200 to 250, and diastolic become 100 to 150. So this is very, very severe condition. Okay, and there is uh, suddenly the patient will have heart attack. Okay, in this condition, brain attack. Okay, damage of kidneys. Okay, and it is very danger condition. Okay, diseases of kidney, disease of heart, disease of eyes can damage brain. Okay, all these organs will damage if this much pressure is there. Okay, so you need balanced pressure. So same applies in our life also. Okay, we need some pressure, but that much pressure also damage your body, and no pressure also damage your body. So you need middle and accurate amount of pressure to lead the normal life. So that is 120 by 8. Okay. So today we will discuss about primary hypertension. Tomorrow we'll discuss secondary hypertension. Then afterwards we will discuss the treatment part also. Okay. So any doubt, kindly ask, and the reasons, symptoms, all this we will discuss.